Welcome back to IRG Physical and Hand Therapy's Health Talk. I'm Ron Schakal, filling in for Tom Hutler with Shannon O'Kelly. And our next guests are two doctors, Dr. Knisely and Dr. Litvack from Swedish Pituitary Clinic here in Seattle. And Shannon, what are they sharing with us today?
Well, they're going to talk about the Swedish Pituitary Clinic. You know, we talk about specializations in medicine, and this is a significant specialization. Here you have two physicians with very well-trained, highly skilled with a pituitary clinic. And the pituitary gland is this gland you have in your brain. It's very active in a lot of hormone regulatory activities. You know, but again, we're gonna check in with them about what they're doing, what they can provide patients with problems with the pituitary gland. Very interesting stuff.
Let's do that right now.
Guess what? We have two guests with us today. Joining us, we have Dr. Knisely and Dr. Litvack with Swedish at the Pituitary Clinic there at Swedish Hospital. How you all doing today?
Doing fantastic.
We're doing great, Shannon. Thank you. Thanks for having us.
Thank you for joining us. So we're just going to have a little round table here, a little discussion. I want to learn about both your backgrounds, your education, your interest, and what the Pituitary Clinic looks like for pituitary conditions at the new Swedish Pituitary Clinic. That's a mouthful. Let's start with Dr. Knisely. Give us your background, give us your education, and then we'll go to Dr. Litvack. How's that sound? So, Dr. Knisely, tell us about your life as a physician.
Sure. So, I'm a rhinologist and a skull-based surgeon, and I was very happy to be a University of Washington medical student. So I was a Husky to start out with, and then I did some of my training in Pittsburgh and then also in Australia, doing predominantly rhinology and skull-based surgery, and then was really happy to come back to Swedish and to the Seattle area to help practice and develop our new pituitary and skull base program, because it's really exciting, because it's a multidisciplinary group of people who are all fellowship trained, and it was really exciting to get that started. So I guess that's the little 20-second blurb on me.
That's great. Dr. Litvack, your turn. How about you?
Yeah, so I'm a neurosurgeon by training. I did my undergraduate medical schooling on the East Coast, and then my residency in Portland, Oregon, which is when I fell in love with the Northwest. And an opportunity came up about 6 years ago for me to come back. When I had finished my training, I spent an extra year. I was one of those crazy people who wanted more schooling, just doing pituitary surgery for a year at Brigham and Women's in Boston with somebody who's done, more of that type of surgery than anybody. And my practice now is predominantly in tumors inside the head of the nervous system, which includes pituitaries. And as Dr. Knisely said, was very excited to join this group. And after about 5 years of hard work, finally paid off, and we have this beautiful multidisciplinary pituitary center now.
Wow. Okay, so I'm going to go back in my experience in anatomy and neuroanatomy way back when I was in physical therapy school. The pituitary gland. This is this unusual gland that we don't hear a lot about unless it has a problem. Let's talk about the pituitary gland. Let's do a little neuroanatomy and physiology here. Can someone grab that?
Yeah, I'd be happy to. So the pituitary, I like to tell patients that this is like the Wizard of Oz behind the curtain, pulling all the strings. And your pituitary gland really is what tells all the other glands that produce hormones, like your thyroid gland or your adrenal glands, when to make and when to release these hormones into your bloodstream and keep your physiology well orchestrated. And it's very small. An adult pituitary gland is only about 9 to 12 millimeters. It's like the size of a pea. And it's sitting at the base of the brain at the back of the nose, which is why Dr. Knisely and I work together, because it's literally at the intersection of the nervous system and the territory that would be covered by an ENT surgeon like Dr. Knisely.
Back with more right after this timeout on Como News 1000 FM 97.7.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Welcome back to IRG's Health Talk, and it's time to hear more about the pituitary gland with Shannon O'Kelly and our guests.
Joining us is Dr. Litvack and Dr. Knisely at the Pituitary Clinic there at Swedish. Let's talk about if I have a pituitary problem. Dr. Litvack, what kind of symptoms would cause me to reach out for help?
Sure. So, Shannon, people fall into three groups when they're diagnosed with this. One is that they have some sort of hormonal or endocrine abnormality, and that could be either due to a level being too low or too high. A lot of times that creates a lot of constitutional problems with fatigue, weight changes, clouded thinking, and other hormonal issues. The second group are people who have tumors that are big enough that it's impacting the visual system, and they may actually get some vision changes and be diagnosed by an optometrist or an ophthalmologist. And then lastly, we get a lot of people who are having an MRI of the head for some other reason, and it's an incidental finding. But regardless of how it's diagnosed, once it's diagnosed, the evaluation and the management of it is pretty consistent.
If I'm diagnosed or there's a problem, what is the intervention? How are you going to fix that?
Well, it's changed a lot and has now evolved into a joint operation. And Dr. Knisely can tell you a little bit more about how we're able to do it and what we're able to see that we couldn't before.
I think that one of the things that's so exciting about this field and about our clinic in particular that makes it really unique is that we really have fellowship-trained people on within each subspecialty. And I tell my patients that the reason Dr. Litvack and I work together is we kind of meet in the middle. I come up from the nose and sinuses and meet at the pituitary, where Dr. Litvack's specialty is the brain and then the pituitary gland. And we've really evolved over time on how we like to treat these patients. I mean, initially it was a craniotomy from the outside and moving brain over, and then we started to use the microscope, but now we actually use something called an endoscope, which is a little lighted camera, and we're able to create a pathway through the nose and sinuses in a way that isn't completely destructive to the nose and sinuses, that opens it up really widely, and then we can use angled scopes and instruments to be able to really see in a way that we haven't been able to in the past. So we can get better tumor resection and better results when we can see what we're doing with the endoscope. So it's truly an exciting time, and to have the opportunity to be able to treat patients in a clinic where and a system in which it's multidisciplinary care is just really, really exciting.
Well, listen, I mean, I'm really excited to talk to both you. I'm more excited to get you back on the radio. We are out of time, but let me just tell you this. It's so exciting for me to do this show, Health Talk, and talk to folks like you and just listen, and the opportunities for treatment and minimally invasive treatment, technology, techniques, advancement in medicine. It is really fascinating. We will have to have you come back on. I need both of you to come back and join us to talk about kind of the intervention, but more about the outcomes in the future. Will you do that for me?
That'd be great.
Oh, yeah. We'd be happy to come back, Shannon. Thank you.
Thank you so much for both of your times.
Yeah, thank you for inviting us.
Well, Shannon, that's fascinating information about the pituitary gland, and you learn so much on this show. It's amazing.
Oh my gosh, we didn't even begin to talk about the real intervention because it was so fascinating. The information, the technology, to have that kind of medical option in the Puget Sound from Swedish Pituitary Gland Clinic is great for our community. We're going to have them back to continue to discuss treatments.